Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. Angie, our nurse practitioner, is here with us. We're excited. We wanted to announce a new branch of our wellness program that we're going to be adding very shortly. As you know, we're in a very fast-paced society. We wanted to do things, but get back to our lifestyle, back to exercising, activities, and certainly back to work in a timely fashion. Our surgical techniques have improved greatly over the years, but there's a limit how fast we can get patients back to their lifestyle. So there's been a tremendous amount of research over the last few years, and Angie and I have been doing a lot of research on those topics. And so we're excited to bring in our own IV therapy that will encompass different facets of your life. We're right now focusing on our surgical patients and our patients with weight loss to help restore maybe some amino acids that we've researched, also vitamins and fluid that can help a patient heal more quickly, get you back on your feet, and also the things that I'm going to have Angie talk about, because she's going to be the one going through and seeing the patients and starting the IVs and monitoring you. But what we've decided to formulate and offer to our patients, I think is going to be extremely successful.
With this new program encompassing wellness for our patients, like Dr. Antimarino said, before and after surgery, weight loss. So in this bag right here, we can actually help get you planned a little more healthy before surgery, so a few days beforehand, targeting making sure that you're getting your vitamins and that absorption is much quicker. We have some patients that can't really absorb well. Maybe it's a gastric sleeve, maybe they've had other surgeries in the past or other conditions that prevent them. This helps considerably because they can absorb it within the hour and a half that they're here with me. So coming in, starting an IV, and really before that, you're having a consultation, your medical history is reviewed. We're making sure that this is appropriate for you also. So medically, clinically, this is the right option. So beforehand, we would start the IV. This runs for about an hour and a half based on what type of infusion that we've recommended for you. So we're going to start with about 3 different infusions so far. There is an immunity, and that also has zinc in it, so that's helpful, making sure that maybe you've traveled before surgery. Let's make sure that you're optimized just vitamin-wise before you have your surgery. Also, to recovery would be coming after surgery, so making sure like the vitamins, the amino acids that Dr. Antimarino has said are back into your system afterwards. Everyone knows after surgery we don't feel like eating a ton. We kind of sometimes will back off our hydration, and this can bridge the gap in healing a little faster. The third is going to be beauty, and that also has biotin in it. And so when we take biotin by pill form, we absorb some of it. Naturally, our gastric enzymes and juices really deplete that, and so the absorption is less than if we actually do it through the IV. So we have a lot of options that are coming. Like Dr. Antimarino said, we've done a lot of research, looked at a lot of different facets on how to get the best, healthiest patient before and after a procedure. So when you're here, if you're interested, we'll be talking about that, especially if you're coming in for consult and we're doing histories and physicals with you. We're going to ask those questions. We already asked now what supplements you're taking, if you're taking peptides, if you're taking GLP-1s, what surgery you've had. So those questions we already are screening for, but now we're having options to better treat our patients.
Right, and some of the agents that we're using are anti-inflammatory, so to really try to control the amount of inflammation that you produce so that your scarring is appropriate, also in a timely fashion to help get you back to your lifestyle, back to work much quicker.